Welcome to Research Renaissance, presented by the Karen Toffler Charitable Trust. Embark on a journey into the forefront of cutting-edge brain science as we feature insightful discussions with a diverse array of guests, from early career researchers pioneering groundbreaking science to influential voices in investment communities, policymaking, and research institutions. Together, we delve into neurological diseases, their causes, treatments, and the quest for cures. Join us in advancing our understanding of the brain and addressing its ailments. Welcome to Research Renaissance. I'm Deborah Westphal, your host and guide through the fascinating future of the brain. Joining me today is Dr. Wendy Ellis, an assistant professor of global health at George Washington University's Milken Institute School of Public Health. Wendy is also the founding director of its Center for Community Resilience. Today, we will be discussing frameworks to drive community-rooted and system-level solutions for health equity. So welcome, Wendy.
Good afternoon.
So in preparation for this podcast, I sent you some ideas for some questions we were going to go through, just kind of give some guidance here. And the response back I got from email was, "You're on a summer tour. What are you doing and where are you?"
Where am I not? It started in May. I had an opportunity to do a bilateral meeting on race and equity and identity in Paris. I mean, of course I'm going to go there, but it was really interesting, to have these community conversations again. And so much of what we discuss about race and systemic inequities in the United States, it feels like we're the only ones, but honestly, it is a global issue. And then being able to bounce back in the United States and be in Cincinnati, be in Columbus, go to Banff, go to Montreal, and really just sit with community members, not just researchers, not just, stakeholders or policymakers, but the folks that are on the ground that really do inform how I go about doing the work that I do. So summer, it's a barnstorm, but I grow so much and I learn so much. And particularly at this time where the translation of the science is getting more rapid, it's really interesting to go back to some of the places where I've been previously and see how quickly the science is being translated into action.
Yeah, that's amazing. And I love that you're out there and you're talking with people. What are kind of some of the common themes that you hear from community to community, and what are the real differences? Especially I would be curious about US and Paris, right? What are those things that are the same and what are different?
Yeah, I think, let's start with the US and Paris. And at that particular meeting, there were individuals who were from the French diaspora. So, you think of Paris and you think of France, but understanding that, they have many colonies, they have many territories. And so across that diaspora, you have many folks who you may not necessarily assume that they're French. People of color, when we're looking at the various islands, but that is really at the root of understanding the commonalities with regard to what we're going to talk about later is adversity that has come from colonialism. And so understanding that conversation through the lens of those who are from various territories of France and also of Britain. We had a number of individuals who were from Britain who were, from august organizations such as Chatham House, but then others who were working on the ground with refugee communities and understanding the long tail impact of colonialism itself as a driver of a historical adversity that we've seen across race and across place. And I think that is the commonality that I also see in the United States. And really at the end of the day, what we're seeing is globally the gap with regard to economic opportunity, economic mobility that's the common thread, whether we are in the United States or whether I was in France or in Canada, it is really that gap that is driving so much of the adversity that we're seeing at the community level as well as at the individual level.
Yeah. Yeah. No, I appreciate that. So in 2024, you became the inaugural director of George Washington's Institute for Racial, Ethnic, and Social Economic Equality. And we're talking about that right now with your summer tour. And it was an opportunity to extend your pioneering Pair of Aces framework. What is the Pair of Aces framework? And can you tell us about that? And how does it help with these gaps and kind of the system level look at healthcare?
At the Equity Institute, initially I was really reticent to take on yet another leadership position as if I didn't have enough jobs. But this idea of being able to not only do this work in community, but raise the level of consciousness and collaboration at the university was really important for me, because it's really important that we have a next gen of leadership that can take on this work. And that was actually what was so important behind the Pair of Aces framing to begin with. I actually developed that early on in my doctoral studies because I recognized that what I was trying to do was move away from a conversation and an application of adverse childhood experiences to just the individuals. This was during this explosion of investment that was happening in the early 2000s around the ACEs science, whether that was CDC or some philanthropic individuals who were really investing in, and of course some were looking at biological markers. Can we see, a predictive way of understanding, is this person going to have a higher propensity to commit ACEs, or can we understand the biological impact of ACEs by doing hair samples and things of that nature? And I said, it's so much bigger than trying to solve this by looking at what's happening at the individual level. When you look at a pioneer researcher like Ann Maston, who already helped us to understand what were these protective factors that helped individuals bounce back from adversity. And when you really look at those things, such as, a safe adult that a child could seek comfort with or protection with, household stability, do they have the same place to sleep every night? Do their parents feel supported in their network? So social connections. And what you really were looking at is, from the science of resilience, we understood that this is more systemic. The solutions are right there in the communities where we live. And so if we're not addressing the root causes and the root opportunity to address adverse childhood experiences, then we're really not going to solve this problem. It's not simple as an RX, a prescription, or a treatment. It is a treatment at a much larger level from, a systems perspective. So that Pair of Aces was a way of me thinking, how can I communicate this complex science of adverse childhood experiences, social determinants of health, resilience, systems science, understanding how systems interact with one another. How do I do this in a simple way so that it's not just researchers, but it's policymakers? It's those that are in community wanting to have a greater understanding of, why do I feel this way? And why does it feel like from generation to generation, I'm having the same experiences, even though I may be doing something different? So that was the Pair of Aces framing. It's so important to think about adverse childhood experiences in the context of adverse community environments. And the simple question that we pose when we first start doing the work is, what's the problem that you're trying to solve? And what's in the soil? So when you look at that tree and you start telling the story of what's the problem that you're trying to solve, you're not just talking about people, you're talking about systems, you're talking about investments. And that has, I think, fundamentally, and I'm very proud of the fact that it changed the direction of the conversation to more of applying a systems thinking approach to adverse childhood experiences rather than just how do we fix people. It's not an either or, it's a both and.
Yeah. Can you give an example of the systems that have changed because of this thinking? Because, that's a really powerful thing. Sometimes people, they're trying to make it work, but, we've all been to the DMV and you're trying to make it work, but you're just not able to communicate sometimes. So what are some of those examples of really changes?
Let's talk education first. One of the things that when you look at the community resilience framework that I developed, it is really thinking about the systems that are most proximal to a community that actually influence those community environments that we see. And oftentimes those variables that we measure around social determinants, such as educational attainment, housing stability, or justice involvement, are outcomes that are related to the practice of those systems. So let's start with educational attainment. Yes, it is a social determinant. Yes, a person can, their life trajectory can be predictive or closely associated with their levels of educational attainment. But what educational attainment tells us at the population level is how well is that system performing to actually successfully help individuals matriculate and move forward. So it is a both and again. So the systems perspective is, what is this system actually doing to provide the supports, the resources that are needed for that community writ large, that school population to be successful? And that was the question that was posed to our partners in Oregon, in Portland, Oregon, when they began to work with the Fabian School. That was the largest, school population was the largest catchment area in all of Portland Public Schools. And it just so happened to be, and I say happen with air quotes, that the way that the catchment area was drawn for this is that they were pulling the kids from the highest concentration of poverty in that district. So you take kids that are coming from a community with the highest concentration of poverty, and they're congregating them all under the same roof to be educated. This was a school that didn't have art program, didn't have phys ed. This is an elementary school that kids, like the recognition of the trauma of just living in poverty, not, counting in violence and housing instability, all the things that go with that. There were no supports that recognized at this school, if these kids are going to be successful academically, we have to lower the temperature of all the trauma and the trauma voices that are going on in the back of their heads. But is that the job of education? I mean, teachers are doing enough as is. And oh, by the way, at the school, the students to teacher ratio is one of the highest in all of the school district. And it was a pioneering principal who came in and said, we're setting these kids up to fail. But just across the way is Concordia University. And guess what? They have a social work program. They have an education program. They have a phys ed program. What if we partnered with this university and their students who are matriculated can be getting their practical credits and experience with a partnership at my school? So that's how she began to fill out the curricula in a way that was what these kids needed. We couldn't have, or she couldn't afford to have a behavioral therapist who could do art therapy, but she had a student who could do art classes and work with those kids. She had students who were interested in physical activity and physical education. So why not have them come in and teach gym class and have this, opportunity to partner with the university? Well, that was the beginning. And then they realized perhaps if we partnered with another behavioral health care provider, they may be able to bring in services and actually bill for that, because so many of our students were Medicaid provided students or recipients. So they could receive mental health care, behavioral health care in the school. And one of the other things that we often overlook is the students that are living in these conditions are being taught by teachers who similarly are living in those conditions and bringing those types of stressors and trauma to the workplace. And so also understanding that we had to support those teachers, address their traumas, provide a safe space that perhaps we could create support amongst the faculty so that they are actually in the best place to be able to teach our kids. Well, food insecurity was one of the biggest issues, not just among the student population, but also amongst the teachers. So they partnered with an organic food provider and gave them a space in the school so that fresh produce and healthy foods were coming into the school. You could use cash. You could use your EBT cards. You could use credit cards to exchange for food and to normalize that the teachers were using it. So there was no shame. It was what's shameful about healthy eating. And parents began to get engaged in this. And the parents helped to co-design this school in the sense of what are the other partners that need to come in so we can co-locate everything that this community needs under one roof. And so that's where, I'm talking about healthcare, I'm talking about social care, I'm talking education. I'm talking about law enforcement, because there was a program there where you could have officers beginning to know the kids, beginning to know their families. So it's tearing down some of those walls where if I'm in this zip code, man, I just want to get home at the end of the day safely because I don't know who these people are, but I know what are the statistics for this neighborhood. But what if you actually got to know each other? That changes the dynamic, that lowers the justice involvement. What we saw was those kids that was the only, in the first year of that program, those kids were the only kids in the entire school district where they saw a rise in their reading readiness, kindergarten readiness. So these are things that we measure, that we value. And it wasn't that the school district had to pay an extra dime for that. It was pulling in partners who are already doing that work, collaborating that work in a way that actually produces outcomes that are mutually beneficial for the systems, but ultimately for the children and families.
And there's such a downstream positive effect by doing this. I mean, the Karen Toffler Charitable Trust focuses a lot on neurological diseases. And, studies have shown that if you have these economic gaps, or if you're from certain demographics, that you have a higher rate or higher probability of Alzheimer's or, some sort of dementia, if you would. And so if we can catch it early and start working the education that allows for, a chance to be economically stable, to have better health care, to have better food, to be able to exercise, that maybe, just maybe, that lowers your probability of getting some of these horrific diseases as you age. So I love that example. And I think that's just so important.
And, it's not just the health benefits or the social benefits. There's a real economic return. And I think that's something that has been missing from the conversation. And that's part of my latest chapter in the work, is creating a means by which we can begin to measure both social and economic return on these investments. So that's the opportunity dashboard. And I'm very excited about the work that we're doing in Cincinnati, where we're working with community partners, but also lawmakers and philanthropy and county commissioners to understand what, using the public health theory of change, but also understanding that pathway of adversity. There's a great body of science. The higher the ACEs score, we know the higher propensity or the higher risk for maladaptive social and health outcomes. But what is that, what does that mean to, let's say, a Procter & Gamble or to a grocer? Not much, really. But what does mean something to them is when we start to talk about the community investments, the philanthropic investments that they make, say, a Kroger, A Kroger company, they will invest in food donation programs, food access programs. But at the end of the day, they want to move people from the donation line to the checkout line. If I'm a bank, I want to move people from the check store to a checking account. Well, there's a financial investment. Their outcomes, their desires are not separate from what is our desire to heal people from adversity. But what we fail to do is actually create this through line, a narrative that helps. Yes, we're talking about long-term change with regard to health and social outcomes, but there are economic outcomes, that are just as important to our business leaders, to our city leaders, that oftentimes when we talk about an ounce of prevention and a pound of cure, it means absolutely nothing to someone who has to run for election in 2 years. So what is really innovative about the work that we're doing is we've created this dashboard that helps all of these folks, philanthropy, clinicians, and lawmakers and such, to see what our collective investments in place, what is the trajectory of change and the rate of change over time. So putting on the same dashboard about reductions in poverty and reductions in child abuse and increase in kindergarten readiness with a dashboard that also says, and here's what we can expect to see in labor readiness, in GDP, in employment, then the light bulbs go off. And it goes, you may not care about adverse childhood experiences. I wish everyone did, but I certainly can see how the science can inform from an economic standpoint what we have an opportunity to do to change the trajectory for many people who may have otherwise been, you're just an ACEs score to me.
Yeah, it's so interesting. Even Homeland Security identifies human capital or the human system, if you would, of the United States as a critical infrastructure. But yet, measuring that or thinking about that in the long term, and that to me is what you're doing here, is you're looking at those root causes and kind of at that root and saying, hey, if we help it on this side, there's a little bit invested this side, but a lot of gain on the other side. And I love that you're measuring this. How hard is it to measure, and how many years of data do you have?
So we've been at this for about 10 years in development. It started with, how do you measure resilience? And not just in the perspective of the absence of trauma or reduction in abuse and neglect, but really going back again, I'm going to state my shiro, Ann Maston, because I really felt like when you read her work, the 4 pillars of resilience around nurturing, around relationships, those can be unpacked. First, we can qualify them by defining them, but then we can quantify these things as well. And one of the things that was really important was this idea of measuring hope. There's been a validated hope scale that's been out there for years. And 2 of the important components of that are agency and motivation. And so when we started to look at this, it's like, how would you measure agency? How would you measure motivation? And what are the factors that actually promote that in individuals? So on the social side, you can begin to see, how do these interventions foster hope and begin to connect hope to social cohesion? Let's unpack social cohesion for the purposes of the exercise. So neighbors taking care of neighbors, coming together, third spaces, social connectedness, but that also feeds into social capital. And so the more social cohesion you have, the greater the social capital you have, and then the greater the ability for these groups, communities, to actually advocate for the change that they need. So that's one piece of it. And then you get down to the nitty gritty. And we're building one right now, a model for Cincinnati. We have about 410 different variables that are health variables, social variables, but also economic variables. And you go back for about 25, 30 years for retrospectively, to begin to see the trends and connecting the investments to the population level trends that we see, to use what we call adaptive digital intelligence, which is really training AI to understand community resilience from the framework itself. So it's not AI in the sense of, AI is really just predicting the next word based on a large language model. What we're actually doing is training AI to the science of resilience, the science of adversity, the science of systems themselves and how systems interact to produce the community environments that we see. So that when we're looking at, say, an investment in workforce development, we're going to be able to predict based on past trends and the population trends themselves. What does that look like with regard to reduction of poverty? What does that mean as far as kindergarten readiness? What does that mean with regard to homelessness or stabilization of households? And then again, what does that mean? Yeah, of course, workforce development, you're going to make the assumption that it's impacting unemployment, but it also means that within the constellation of variables that I just described, it has an impact on GDP. And one of the things that we found in working with our partners in Cincinnati is when you actually create higher employment for individuals, you're moving people from the unemployment line to, safe, stable employment, it slows down GDP because you don't have as many people that you have to recruit from outside. So as a lawmaker or as a mayor, I'm thinking, but I want GDP to grow. Well, if you want GDP to grow and you want to continue to create thriving in the population that you have, then there's no silver bullet. It's not just workforce development that you have to invest in. Perhaps there's another lever, and we can put that into the model. So under the hood of this is something that is completely reliant on understanding the complex neural pathways, biological pathways of the effects of adversity, but also understanding the complexity of the interactions of policies and investments over time that create those interactions, create the environments that could either help an individual bounce back or exacerbate the experience of trauma. So this is brain science meeting economic science and using the adaptive digital intelligence to say, it's not just a clinical cure, but we can cure ourselves by actually investing in the things that matter, that the things that, not only prevent trauma, but also help us to bounce back and bounce forward.
I would imagine too, with this, kind of detailed look and ability to ask questions, you might be able to ask questions like, why are we measuring GDP? GDP may be the wrong measurement for, wealth creation or, health or resilience, whatever that may be. Do you find yourself kind of questioning some of the institutional things in the way we talk about things and say, why are we doing it this way?
Yeah, I mean, I would never, I'm public health trained, MPH, DRPH. So I am not an economist by any means. So I had to do a lot of study to kind of understand, well, why is GDP even relevant in this conversation? And I think one of the things that's important, I wouldn't throw it out with, and say, oh, GDP is not a relevant metric. But what I would say is none of these metrics are relevant in isolation. We have to be willing and able to look at the constellation of these metrics and step back and what is the story that the data are telling us. And so, an important maxim that I learned early on in this is that there's no stories without data and no data without stories. Anytime that you want to focus on one indice or one data point, you've missed the story because there's so many other data points that actually inform that one data point that you're looking at. Like I said earlier with the example of the Fabian School, kindergarten readiness, you would say, oh, look, the Fabian School really is doing something in that classroom that's making a difference. They took care of their teachers. They made trauma-informed care and practice like supreme number one, and look at the difference in kindergarten readiness. If you only made the association between those data points, you're missing a huge story here, because it wasn't just that. It was stabilizing the school environment with all of these other inputs. And the other part of this that was perhaps not so readily obvious is this social cohesion that was created between community, the school community, and the community where these kids lived. And so that created an environment that was safe, not only when they were at school, but they also felt safer at home. Reduction in stress for everyone. So I wouldn't say that GDP isn't there is no the right data point. It's how we look at these things in context. How are they interacting? It's just like a neuroscientist, when we're looking at, these maps and we see the neurons and the interconnectivity, we would never say that, it's just that one neuron. No, it's that neuron in the context of what else is happening inside that system, but also inside that person's nervous system writ large. So I think that's, I would hope that those that are more on the clinical side, particularly the brain science side, could see the correlation there. It's like you would not treat a patient just by merely looking at one symptom. You zoom out to understand what are all the pieces, that family history, what's happening in their environment today, to be able to surely diagnose and even create the custom treatment that's needed for that person.
Yeah. Yeah. So I'm sure there's some early career scientists, researchers that are listening to this podcast, listening to you, and really have that aspiration to do what you're doing and to continue the work. But they're probably, research and science it's a hard career. It's a really hard career path. And, they're probably, impact versus tenure, and what do you have to do to, stay in the research field. What advice do you give those that you coach and mentor trainees that want to really kind of embed this community thought, co-creation with really academic pathways, rigid, very rigid academic pathways?
I think first off, I have to recognize I'm a knucklehead. Okay. That's a very technical term, but I just don't hear no. I am just pathologically programmed to just say, I'm just going to go forward and do this. So I do think, particularly as a woman and as a woman of color, I make the assumption that I'm just going to have to do it my way, because academia, number one, was never meant to accommodate me. In fact, it was built intentionally to exclude me, even in 2025. So I knew it was not going to be easy. I did not know that it was perhaps as cutthroat and competitive as it is, but whatever. You just keep going. And I really love mentoring my students, because I tell them, if you're interested in systems work, it is never going to be easy. I don't care what gender you are. I don't care what color you are. Systems were designed for the outcomes that they create. And we have some very hardened systems in this country and really globally that were meant to and designed to create inequity and trauma for the majority. So if you are in this work, you are not signing up for something that is easy. So let me allay that idea for you first. And then I just feel like being in community has really validated this work more so than my peers ever could, more so than a journal reviewed article ever could, because I've taken the science, and much of what I've taken, I've proven Ann Maston's work by working with these communities. I'm proving the social determinants of health theory, but I'm tinkering with it and actually saying it's both and. It's not just what an individual, a characteristic is ascribed to an individual, or a quality that's ascribed to an individual. It's actually a performance measure hiding in plain sight. And so to me, that is really thrilling, because we are opening up the door, a new door for all of this science to converge. And so I would say, the first 10 years of my career have really been about the impact side. We've been rapidly translating the science and rapidly getting real measurable results. It's not always what academia rewards. But what's most important is I've got policymakers that are changing policy. I've got investments that are being made. And I don't want to say I want to say the folks that I'm working with in the field, the communities that have adopted the BCR process, those who are using the community resilience framework and actually helping that guide their thinking with regard to investments in community. And most importantly, I see community members who are advocating for change in their roles, in their communities, and how their councils spend money. So that is right now, the bigger bulk of the proof and the weight of my work. I'm moving into a new phase where I have so much to write, and I will write, and I'm continuing to write. But it was like you had to if you're going to do community engaged research, if you're going to do translational science, then you're busy translating, which means you're in the field. And I think academia is at a point now, particularly given the current challenges with regard to funding, is that what is your utility? A lot of folks are asking us that. We don't need a lot of articles. We don't need, I've walked in the community and said, we don't need more research. We need more doing. And I think that this is, my body of work is an example of how do we take all of that wisdom, all of that knowledge that is up in the tower or in some dusty journal and translate it because our communities need it. And, Ann Maston's work is more than 20 years old. And now, I'm watching it be translated into something that is impactful for communities.
At a time that it's really needed, and a very complex time. I mean, we have all these systems. I think it was really striking what you said about these systems were designed for, a specific outcome. And now these systems are connected in ways that we would have never have thought. And having this system level kind of thinking is so important because you can't do anything in isolation without affecting two or three other systems negatively. And so I think this is, just really, really important. And the other thing you said is it's not easy. I'm sure you get pushback. I'm sure you get, I just don't understand and I have a job to do and, I know how to do it. So I'm going to continue on the way I'm doing it. What is that pushback and what is that resistance, if you would? And, what are some ways that you're addressing that?
Yeah, I've learned in the years that I've been doing this that resistance always falls to persistence. So, I
Especially if
may
you're
not.
somebody that doesn't hear no very, very often,
No,
right?
yeah, from the person who just doesn't, I just don't hear no. Just go, oh, okay, so I have to try this a different way. Okay. I will give you an example. I won't name the place, but there was a particularly resistant lawmaker who really did not buy into anything that I was doing. And I think part of it was this, here's this Black woman who is coming in and going to talk data to me. What does she know about data? And what does she know about brain science? And I was like, okay, I see what this is. And I was very polite and I just, constantly kept him up to date on what we were doing. But I also recognized the power of triangulation and strategy. I don't vote for him. I can't vote for him. I don't live in his district. So I have no political weight on his dock, right? He has to run for election every 4 years. But I have a community coalition who very much believes in this work and is very much invested in this work. And they do vote for him. And they do show up at council meetings. And so giving them what they needed to ensure that the agenda was going to continue to move forward and reminding them this matters to us. That was the strategy behind the scenes of continuing to move the goalpost. Continuing to move forward towards the goalpost. And I think that's really important strategies when we talk about translational science, because it's not enough to have the evidence but the data shows. Sometimes the data doesn't matter. Sometimes political pressure is what matters. And God knows we can see that today. And so it is translating how we sometimes have to maneuver within academia to get anything done. Well, how do you zoom out and do that, build power for translation when you're in the field? And that's why I will never trade this level of community engagement that I've done, the relationships that I've built over this time, because that's more important. And it's absolutely necessary if we're going to successfully move the needle from translating this science into action. So yes, the research is necessary, the data are necessary, but it's never going to be sufficient when you're talking about systems change. Systems change will move when people are actually advocating and invested in that systems change. And that's the last mile of the research that we have to do that oftentimes is not rewarded in academia. But, that's one of my other side jobs, is fighting that and trying to stand as an example for others who come behind me of we do have to consider translational science is very important and necessary for the future of academia.
Yeah, I think that's powerful. And, the story here, I think, is really of empowerment too. And, you can, back to the school in Oregon, you're empowering a whole generation of people that can see, the change that they went through. And now that just multiplies. It just, it impacts the future in such a powerful way. And so I think that's just, it's just amazing.
Can I say something about the use of the term empower? And this comes from all the years of working in community. What I have recognized, all of us have an innate power. It's whether or not we've had the ability to exercise that power. And so I see my role as less about empowering anyone, as helping to remove the obstacles so that their power can be exerted. Part of the reason why I don't hear no is because I've had wonderful mentors who, with sharp elbows, who at times have said, get out of her way, or Wendy, you just focus on this and just keep going in that direction because I believe in you. It wasn't that they were empowering me. They were clearing the path so that power, that voice had the opportunity to be heard so that the work could be seen. And that's what I think is so important, is that our job is not to empower people. It's to if you've got any access to power, get the stuff out of the way so that they can be heard, so that they can do, that they can go, and they can be. And I think that that's something that we can do as scientists, is how is our science being used in a way that we're helping to get the obstacles out of the way for the people who most need it.
Yeah. No, I appreciate that. And sometimes we use words, and those words can be possibly pretty empty if you don't have that definition that you just went through. It's empowerment is not to give. It's not a gift. What you just said was very important. It is something to do, which is get those obstacles out of the way. So I really appreciate that. I also appreciate the time, and it's gone by so quickly.
I know.
As we kind of wrap up here, how do people get in contact with you? If they're energized to learn more, some of those young people that are wanting to follow in your footsteps, what's the best way to get in contact with you?
Yeah, I am hiding in plain sight, I tell people. So if you don't catch me on the road, all you have to do is Google my name, Wendy Ellis, with resilience, and it pops up. It usually is the first thing that pops up. That is my ministry, is resilience science and translating that. So, but if you want a formal email address, it's wendye@gwu.edu. But again, I am hiding in plain sight, and I love, love, love mentoring and connecting people in a way that, is going to be most impactful for them. That is truly the gift of this work, as well as the mission, is that, it's about power building, it's about changing systems so that we have more just and resilient communities for everyone.
Well, you're an amazing person, and I am so grateful to have been put in contact with you and to have these discussions in preparation for this and today. Any last words, any last thoughts that you want to share?
I think that I would be remiss if I didn't recognize the extreme challenges that our communities are facing today, whether that is because of policies that would call you not American, or those that are, causing many families and communities to have widespread unemployment, or whether that is just the stress of the increasing income inequality and social divisiveness. This is a time for the application of adverse childhood experiences. And I just want us to all think about whether you're a practitioner, whether you're a clinician, whether you are a researcher, doesn't matter what your title is. It's time for us to be human. It's time for us to take care of each other. And I think that the science is the ultimate equalizer. But those of us who know it have the obligation to teach it so that we all can do better together.
Very well said. And I have nothing more to add. Thank you so much.
Thank you so much.
Thank you for joining Research Renaissance. For more information and to stay updated, subscribe for more episodes and visit our website at tofflertrust.org. Feel free to call us if you have any thoughts, suggestions, or just want to find out more about the Karen Toffler Charitable Trust. Until we meet again, onward and upward.